Dear friends, welcome everybody. My name is Barbara Liberowicz. I'm a medical doctor, specialist in internal medicine. I've been practicing homeopathy almost since I graduated. I happen to find myself in the right places, the right moment, meeting the right people. In 1990, I was accepted as an observer in the Royal London Homeopathic Hospital, and that was the turning point. In the 90s, I was running publishers called Homosapiens, editing Polish homeopathic journal, also called Homosapiens. We translated homeopathic books from English to Polish and organized many seminars. Recently, I attended Homeopathic Liga Congress in Sevilla. This inspired me to revive Homosapiens as an online platform for homeopathic meetings and exchange. Here we present the best of Sevilla part 1. Part 2 will follow soon, so stay tuned. Please visit our website, homeosapiens.eu, to learn more. Enjoy watching.
Dear Barbara, thank you for invitation. I enjoy being a part of this webinar. I'm from Vienna, Austria, and I'm a specialist for internal medicine and internal intensive care medicine. And in addition, I'm working with homeopathy for about 50 years. So I just want to show you a study which has been published in the year 2020. And the background of this study was that it's a prospective, randomized, placebo-controlled, double-blind, 3-arm, multi-center phase 3 study. And the intention was to evaluate the possible effects of additive homeopathy compared with placebo in patients with stage 4 non-small cell lung cancer with regard to quality of life in the 2 randomized group. And in addition, there was a 3rd group where we evaluated also survival time in all 3 groups. This 3rd group was included because we wanted to exclude the suggestive effect of the homeopath. In this case, it's my person. And we just wanted to show whether there's a difference between no homeopath and presence of a homeopath. Now, the results showed there was an improvement of quality of life, which was significant in the homeopathy group as compared to placebo. And in addition, surprisingly, there was a significantly longer survival time in the homeopathy group versus placebo and control. And this study was published in the journal The Oncologist, which has an impact factor of 5.5. This is the slide which shows median survival time in days. And you can see that the green bar is the homeopathy group. And those patients are living about 6 months longer than the patients in the placebo control, and about 7 months longer than control patients who have not seen a homeopath at all. Now, I want to put together an executive summary. In June 2021, a complaint against our study was made by the leading anti-homeopathy campaigners in Germany and Austria, spreading their defamatory accusations on public platforms, and submitted their complaint to the Medical University of Vienna. For those of you who don't know, I've worked and served for 40 years at the Medical University of Vienna. The last 15 years, I was running an outpatient clinic for cancer patients seeking for additive homeopathy. The Medical University of Vienna forwarded this complaint for external investigation by the private Austrian Agency for Scientific Integrity. In September 2022, this agency sent a so-called final statement. It was not a review, it was a final statement concluding that there are numerous breaches of scientific integrity in the study. Several of the results can only be explained by data manipulation or falsification. Now you can understand that this was a severe accusation which I've never experienced so far before. Now, we provided a detailed point-by-point response to the accusations. This was done together with HRI, especially Rachel Roberts and her team, as well as by Markus Reif, a German statistician. He is working together with Stefan Baumgartner. The quality was actually assured by the computerized randomization program randomizer, which runs a protocol, the so-called audit trail. So at each work with a patient, with each appointment, there is a protocol which cannot be influenced by any one of these researchers. Only the planning statistician had full control of this randomizer. So this is actually the most important quality assurance of our paper. And this audit trail proves that no post hoc exclusion has happened, because one of the accusations was that we have included the numerous exclusion criteria in our paper only to exclude patients after at the end of the study. And this is merely impossible. So this is a very high quality sign. And we stand by our statements that homeopathy positively influences quality of life and homeopathy positively influences survival. Now, the oncologists conducted an in-depth investigation that lasted for a total of 2 years, and you might understand my emotions during this time. Finally, the oncologist just recently published an explanation as well as an editorial confirming the correctness of our publication. This is this so-called correction. Actually, it's more a clarification and explanation. And this is the editorial, which is written by a pharmacologist from NCI and NIH in the United States, and Susan Bates. She is the editor of the journal. Now, conclusions are: truth must remain truth. Thank you for all of you who have supported my defense. Thanks to my friend Jürgen Ivanis, who accompanied and coached me through all the difficulties. And this is my friend Jürgen together with me. And the important message is never, never, never give up. It is said that this is a word of Winston Churchill. Thank you for your attention.
Okay, thank you, Professor Frass, but it will not be as easy for you. As please, can you tell me what are your impressions as general doctor, homeopath, treating this patient? What can we possibly achieve in so serious state, lung cancer, stage 4? What it is possible? How can we help the patients? How did you choose the remedies? Please, could you please explain randomization process and how did you manage placebo control study with homeopathy?
No, this study was done at the Medical University of Vienna together with 3 other centers, especially the Otto Wagner Hospital in Vienna. And randomization was performed in this way. We asked the patient whether he or she would be willing to participate in this study. And after signing the confirmation by the patient, Then I did a detailed anamnesis, and what I tried to include was is the so-called fluids, the Q potencies. In some way, I have used this similar to what is done at the hospital there's some voice I cannot.
Okay, I'm mute. Sorry.
No problem. And it's similar what is done at the hospital by Dr. Spinelli in Switzerland. And I gave either one or sometimes two Q potencies. Actually, one of the indicators I used was the location of the tumor. So what I did, I looked to the rubrics of inflammation, and if, for example, was a tumor in the right lower field, I looked to kalium carbonicum, mercurius, and phosphor, and then I tried to include this information in my anamnesis. Furthermore, with regard to side effects of chemotherapy, I prefer Nux vomica, LM6, and I recommend patients to take Nux vomica up to 3 times a day. If Nux vomica does not help, then in addition, I prescribe Ocubacca C12 or CH12 in the same dosage. If there were, in some cases, radiation therapy, I recommend cadmium sulfuricum CH12 every day during this time of radiation. But in addition, in some cases, in most cases, actually, I used phosphorus, which was not so astonishing. What I would say to my colleagues is, I did this anamnesis sometimes under extreme circumstances because patients were in a room with some other people and there was no other logistic way to make this anamnesis. And therefore, even under extreme circumstances, I am sure it is possible to find the correct remedy and to help the patients. So just try. And quality of life can be improved. This has been proven some years ago. We have published this in 2015, and this is also a part of the German S3 guideline, which includes this as a possible addition in cancer patients.
Professor Frass, thank you very much. We hope to see you frequently on our platform. Thank you again.
Thank you. Goodbye.
Bye. If you allow me to introduce you.
You may do.
Yeah. So
yes.
We met at the lunch dinner in Sevilla, and we started to chat. And Dr. Jeggels told me about the most jaw-dropping case cured with homeopathy ever seen in my life. Was it a good introduction?
I think so. You found it incredulous. You found that this cannot happen. It is just impossible. So I think I will then share the case with you. It will probably take about 16 minutes to do. I shall go full screen. I think everybody should be able to see my full screen. So wait a minute. I'd also just like to get a laser pointer. So the case that caused your jaw to drop was the treatment, homeopathic treatment of large mitral valve vegetation that was treated in 2020. Concerning infective endocarditis, previously it was called septic endocarditis, so It's called infective now because it's not just bacteria which will cause endocarditis, inflammation of particularly the heart valves. So this was already recognized in about 1500. So this is a report and a review by the CDC, Center for Disease Control of the United States. And they say that it is potentially curable with appropriate antimicrobial treatment. So in general, the time needed for recovery is about 6 weeks, and you need about 4 to 6 weeks of antimicrobial treatment. However, not all patients do that well. Some need to have a valve replacement, and there are naturally complications. And I'll show why some of these complications take place. So some patients develop blood clots, they develop stroke, heart rhythm problems, abscesses, and some patients can really be very severely ill. This is the European Heart Journal from 2015, who gave the guidelines on how to manage, and they also confirm it is still a very deadly disease. Has a high mortality and severe complications. They give the full guidelines, which we cannot go into. So there's an endocarditis team, consists of many different doctors from different disciplines, etc., diagnosis, treatments, and so forth. So the cardiac conditions that put you at high risk of infective endocarditis are really patients who have had operations, who have had congenital heart disease, who have had rheumatic fever, for instance, where there is really a problem with the health of heart valves. So antibiotics is not recommended for all sorts of valvular problems, etc. And then our social behavior can contribute to developing endocarditis. So for instance, body piercing, tattooing, excessive alcohol consumption, which of course means that you are going to injure yourself, you may fall, you get into fights, etc. And then the not very aseptic administration of illicit drugs intravenously. So if you just look a little bit at the anatomy, our heart, when viewed from the anterior position, if you want to understand the mitral valve particularly, because that is where the focus is on, if there would be a section in this plane of the heart, when you look at it from the front, one can see the various components of the heart with the mitral valve. So that is really the posterior leaflet of the mitral valve, and that's the anterior leaflet of the mitral valve when we open it up. With the right atrium leading to the right ventricle, which passes blood into the lungs, which return back to the left atrium and the left ventricle, with the blood pumped all over the body. What are the symptoms and signs of endocarditis? Honestly, it is not easy to diagnose because the complaints of fatigue, weakness, dyspnea, weight loss, sweats, it's not specific until a patient may show some of these complaints, which are really emboli, which I will discuss in a minute. So if you would see these symptoms, these signs, you probably need to go for your stethoscope, examine, and so forth, and that patient need to be referred. So what happens? Why do these patients develop these signs? Is because this is one, let me just hide that. This is most probably after a valve replacement, that is a mitral valve. But as you can see, there are the vegetations, and all the darker spots are bacteria. And as you can see, it's very friable. It breaks off very easily. And therefore, these little bits and pieces land up all over the body that cause patients to be very ill. Imagine this lands up in the brain, and you have a septic abscess in the brain. And it can land up, of course, as you can see, these little bits and pieces land up in the fingers, in the toes, etc. And they block off little arteries that can cause gangrene. This is, for instance, an article of the replacement of a mitral valve caused by this bacteria. And it is an intraoperative view where you look, in reality, if you look at this, you look from the right atrium through the right ventricle at the back of the heart where you reach the mitral valve. So that is the right atrium, left atrium, and the mitral valve there, where you see the infection on the posterior leaflet of the mitral valve. A drawing of the histology, what does it look like? So that is the left atrium, the left ventricle, the mitral valve with this vegetation sitting there. As I say, an outer cap of eosinophilic material, and then bacteria and all sorts of inflammatory cells, etc. That is what the vegetation grows like a cauliflower. So case of infective endocarditis, I've seen this patient in 2015, 57-year-old. It was his first consultation, only consultation. He had a coronary bypass operation in 2013. He wished to be off simvastatin and cholesterol treatment, which definitely can cause sore muscles. In fact, rhabdomyolysis, which can be very, very dangerous. But emotionally, he was very obsessive, compulsive, fearful, fear of being out of control. So I examined his limbs and evaluated the ankle brachial pressure index by first taking with a Doppler his blood pressure in his right arm, 116, and then in the periphery, the dorsalis pedis. So it would look like that, with a cuff and placing some gel on there and using a Doppler, and you can take the blood pressure in the dorsalis pedis and a posterior tibial. Start on the right arm, right ankle, and left arm. So overall, there's nothing here dramatic. This is quite okay. Neurologically was intact, but he had cracked heels, and that implies Carcinoma album. So just as an example, very ridged nails with a cracked heel, and the cherry on the cake is often white spots on the nails. That is Carcinoma album, full stop from physical. Adults are very often actors, and I like to find physical signs which short circuits make it very easy to use it. I will come to 2020, COVID lockdown, the pandemic. And South Africa had one of the most intense, the strictest lockdowns you can imagine. We were literally under house arrest. You couldn't go on the street except if you go to a shop. So unbelievably strict. So the wife of this patient sent an email on the 7th of May. And this is a letter. The challenging time, of course, is COVID. And he said, yeah, my husband is ill. He's in hospital with endocarditis. There's a vegetation on his mitral valve. He had Staph aureus, not strep, which seems to be clearing. Doctors are giving capsule. The vegetation is not decreasing, it may be releasing. And the doctor showed this vegetation flattening in and out of the atrium, ventricle, etc. And the concern was, of course, if this big thing dislodges, big problems, right? So he was at that moment in a hospital called Gatesville, but his cardiologist, which he has seen previously, was at the other hospital, Vaishampayan, and he preferred to have it done there. So he was then checked out of the one hospital and checked in again later. So she wanted to hear if I could do anything homeopathically, how quickly can this improve, maybe he can come and see you, etc. So homeopathy for septic or rather infective endocarditis, we look at Murphy's repertory and so on. There are only two treatments, arsenicum or nausea. So arsenicum, as I indicated already, he had an infected crack on his heel, and then the other characteristics. So where's the source of arsenicum for infective endocarditis? It's attributed to Dr. Guy Buckley's terms. Now, how he came to this conclusion is just very difficult. I cannot find information. Nevertheless, remember that echocardiography was only really instituted in 1953. So, however, nowadays we have all the evidence and we have the confirmation, etc. So, a differential diagnosis between arsenicum and nausea. So, we have a patient walking in, And what does this patient appear like? An arsenicum patient will be anxious, fearful, especially coming with heart issues. They'll be restless, they'll be pacing, they can't even really sit still, while nausea is the exact opposite. Nausea is like aurum, depressed, even suicidal. My heart, I'm more depressed rather than anxious. So when I see this type of patient, I want to know, do you have ridge nails? Do you have cracked heels? That puts me on to arsenicum, while there's nothing of the sort known with nausea. Lying on the back is worse with heart conditions, while with nausea, worse lying on the left, like lacuses. And arsenicum would have, say, more right ventricular issues, not as severe as cactus. There can be functional murmurs, palpitations, while nausea, there's really serious mitral valve troubles, particularly. So mitral stenosis, tapping apex beat, mid-diastolic murmur. And when there is incompetence, there's no first heart sound, pansystolic murmur radiating to axilla. So physical signs for me are incredibly important. It's like a picture said 1,000 words, right? It's the tip of the iceberg. And if we neglect that, we go into that iceberg like a Titanic because we miss so many important signs. That helps to make the complexity of human suffering much easier, as exemplary competent makes complex easy, not simple, to achieve the maximum outcomes with a minimum of input. We know the tricks of the trade, physical science, keynotes, and so forth. And as Thomas Gilbert said about human competence, exemplary performers do things more easily than others do. Nevertheless, go back to 2020. So a day later, we suggested that the patient's cousin come and collect arsenicum 30C to be administered twice daily, and this is in liquid to succuss. It's liquid potencies. 5 days later, he was seen by a cardiologist, and there's just nothing on the valve. Cardiologist is bewildered. Patient had no symptoms in sight of infective endocarditis, no subacute bacterial endocarditis. I saw the patient only by the 19th of May, when he brought information and he brought the echocardiogram videos that was just taken by cell phone. And that is still the source of his infection on the crack. That is his heel. So yeah, an echo is done. So the echo for this patient is done from, say, this position. It's the tip of the heart, looking up at the heart. And it's about that sort of position. So you're going to this view of the heart, as if you're looking down on your own heart, from the atrium to the ventricles. And this is the video that he brought to me. And that is that big vegetation that is swinging in and out. As the wife said, flapping in and out. Huge thing. Imagine that thing breaks off and embolizes. Patient probably had a fatal stroke. 5 days later, his valve is completely clean. And I'll just let it play further, because there is the color Doppler. The red shows this mitral incompetence. The blue shows the natural flow of the blood flow from atrium into the ventricle. He also brought the report of the cardiologist, and this is one of the most clever cardiologists in Cape Town. He passed his specialization cum laude, or probably summa cum laude. And he said that, yes, the patient is very well known to me. He had a bypass in 2013. Then there was mild mitral regurgitation. But now in 2020, definite diagnosis of infective endocarditis, large vegetation. Antibiotics were instituted from the 17th of April. He insisted on being discharged because he wanted to go to his other cardiologist. And was correctly advised with mitral valve replacement, and has no sign of subacute bacterial endocarditis. There were no Janeway or embolization anyway. No sign of small little gangrenous spots. And he said, the striking feature was there's no vegetation any longer. The valve is completely clean. Difficult clinical problem. And the only explanation really is it has embolized, but there's nothing. There's no sign of septic embolism, etc. Okay, so On a day, I examined the patient, and he had a pansystolic murmur radiating to axilla, and there was no first heart sound. That isn't good. So I said, well, now he really needs nausea. And nausea is attributed to Dr. Boja for damaged heart valves, headaches with heart problems, low blood pressure, and so on, dyspnea, etc., weak limbs. So he was reviewed a month later, cardiologist content, follow up in 6 months, and I examined him again, and the first heart sound returned on nausea. So there was an improvement, a return of the integrity of the valve. So we continued with nausea, and I said, repeat arsenicum only if there is inflammation of the cracks of his heels. So 2 years later, we had telephonic feedback. Cardiologist is happy, no valve replacement. Patient is to discuss his food condition. 18th of July, cardiologist is fine. And up till now, so 4 years later, there's not been any valve replacement. So in this case, your conclusion, this shows biological effectiveness and confirmed via echocardiogram, via all the other studies, bacteriology and so forth, effectiveness of arsenicum, etc. So arsenicum seemed to have averted mitral valve replacement, and nausea seemed to have restored the integrity of the mitral valve with the return of the first start sound. And with that, I thank you. That is the case. I shall.
Oh, thank you, Dr. Jeggels. I hope we will have some time for questions in the end. I will allow myself to ask you, because I was discussing this case also with cardiologists from my hospital. So the question is, what has possibly happened to this vegetation? Because Staphylococcus is known for tendency to self-embolization. But how this possibly could happen?
Well, this one can only say the only explanation is that arsenicum must have triggered that vegetation to dissolve in such a manner that it wasn't embolizing. There was nothing, no huge pieces, because there was no echocardiogram on day 1 or day 2 or day 3 to really see what it is. In fact, his wife asked me, shall we postpone going to the cardiologist? I said, no, to give homeopathy a chance. So I said, no, don't postpone it. This is just so dangerous. This is so life-threatening. Go for the date when you're supposed to go so that we can see what is happening. And what we saw was it's just clean. So only explanation is it allowed just to dissolve into such small pieces that it did not cause any symptoms like subacute bacterial endocarditis, where you have really the Janeway and oscillar nodes or vasculitis with gangrene caused by vasculitis. There was just nothing. It would have been wonderful if one could have made an echocardiogram on each day to see how this dissolved.
Dr. Jeggels, thank you very much.
You're welcome.
I'm aware of your huge knowledge about cardiology. I know you have more cases to show. So can you promise us to share some more cases during next webinars?
Yeah. No, certainly I can share other cardiac cases, etc. with you later. Okay.
Thank you very much. Okay, now I ask one of my co-hosts to enable Dr. Sanjay Modi, because I have no idea how to do this. Dr. Modi, can you hear us? Okay.
I'm doing that.
Yeah.
Okay. Dr. Modi, welcome.
Yes, hello. Hello, everyone.
So we know you are an expert on Organon, which is the book we all respect, but not many of us have ever read it. And I know you will complain about it. So please tell us about Organon.
Thank you, Barbara, for having me here. And yes, my presentation was in the last. It was about Organon itself. I am Dr. Sanjay Modi, for those who don't know me, and I am from Mumbai, and I have been teaching for nearly around 40 years. Now, the topic that I presented in the last Liga was Organon made easy and eye-opener. And my favorite probably question that I generally ask my students is that, is Dr. Hahnemann outdated? Because the way we have probably understood Organon till now, we get an idea that probability is this, that Hahnemann has, whatever Hahnemann has written, has been, an old part of the literature. So it's something like this, where, the obsolete things are there, which you can see. And the way we understand Organon, we also feel that Organon doesn't hold that relevance or importance as probably, the modern medicine is, the way the modern medicine is going. And we generally relate to Organon as theoretical foundation, history and philosophy. This is how we generally relate to Organon. It's a good book which gives you a lot of theoretical foundation, but it's more historical and it's more philosophical. Now, what happens is, because of that, students as well as practitioners feel that they have outgrown, or they have grown over the need to probably refer to Organon again. And anything that is, practical generally will come from, understanding and knowing the techniques and the methods that are used in, solved cases. So all of our practical knowledge we should be now gathering from, looking into the cases that have been solved around. Now, my question is, if we have seen so many solved cases, there has been a lot of solved cases which every day, every time we keep on putting up, and we see it all over in the homeopathic literature, then we should have been more clear. There has to be more clarity that would have come into us. But has it really come from the way we have been practicing homeopathy? Because the current scenario, the way I have been seeing it in homeopathy for the last maybe 30, 35 years, I find that there is a lot of confusion. There is a lot of uncertainty. There is a lot of doubt in the minds of not only, the new entrants or into the system or the pathy, but even for those who have been there for years together. Because I have interacted with, I think, most of the, homeopathic doctors who have been in the field of homeopathy for a quite long period of time. And the reason is this, that, we have many ways and many methods which seem to probably reach to giving results. And we see that there are a lot of methods which we have been seeing which are giving results. So there it creates a doubt or a confusion that which to follow and what not to follow. Now, what happens is, it has become very easy to prove that the method works. We just have to show or support it with few successful cases. Now, we fail to realize that probably there will be some cherry picking that will be happening around in such type of methodologies which everybody keeps on putting across in our homeopathic field. And we fail to realize that the important aspect is not a solved case. As far as, Hahnemann is concerned also, Hahnemann says that the case had to be solved on comprehensible principles. We generally neglect on the part of the comprehensible principles. We don't see that part of it, and we just see a case and the result, and we think the method works. That's how it's been going on for a number of years now. That is because Organon happens to be the most misunderstood and the misread book of all times. One of the reasons for Organon not being read is what you very truly said, that people generally don't read it, is because there is a drawback. One of the drawback is Organon needed to be read in the correct way. Now the reason is that it is an 18th century literature which was written in a time where there were a lot of compound complex sentences. Now what I mean by compound complex sentences is it contains several clauses. Like for instance, if you probably see, these are around 5 clauses that are listed here. Put it simply, they are 5 simple sentences. And these 5 simple sentences go on to make a mega sentence. And that is what compound complex sentences are. So the length of the sentence could go anywhere between 10 lines or even 15 lines at some cases. And this is exactly what has happened in aphorism number 50, where from mighty nature to dangerous is one single sentence. Now that makes it difficult to not only read but also comprehend, because humans, nowadays humans are getting lesser and lesser on their attention span. In fact, we are having an attention span less than that of a goldfish also. So first of all, to read all those things, then to retain, and then to comprehend is becoming a little difficult. So one part of it which I agree is this, that this was one of the drawbacks, but we have worked on this thing, and Organon has been beautifully reworked and rewritten to read something like this. So the 50 aphorism reads something like this. What you see is this, that we have converted compound complex sentences into very simple sentences. So you find that they are very simple sentences that are there. The content is very original. We have not tried to change on the content of the 6th edition of Boric. We have kept it as it is. But there is a unique presentation of different aphorisms. Like aphorism 50 reads like this, the rest of the aphorisms don't read like. There is a unique presentation that is needed, because keeping the content in mind, because content is the king, and we wanted the content to be well, understood by those who read this particular book. We highlighted the important aspects of the aphorism so that the reader gets an idea what he is referring to, or what the aphorism is talking about, or what Herman is intending to talk. So in this particular thing, we also added a connect. So there was a connect between the aphorisms that got established, within the aphorisms and between the aphorisms. So in this particular way, we have seen to it that the first drawback of Organon, the way, the language is there, has been simplified in a very beautiful way. And this is actually the book that I just recently wrote, Organon Made Easy. It took me 3 years to, probably just get it into the print. I feel the way I understood Organon, and though I have been teaching Organon for a very long time, but the way I now understand Organon, I feel the fact is Organon is applied knowledge. It is very futuristic and it is very scientific. What I mean by applied knowledge is that, it contains practical solutions to real problems. And Herman had been not only a missionary, but a visionary. I see a lot of what Herman had written in Organon at that point of time, maybe 250 to 300 years back, still relevant in today's modern medicine books. And I tell you, it's a scientific document. Let's take an example of what I am trying to talk about. Let's relate it to an example of, Organon. Why I say it's applied knowledge, it's futuristic and it's scientific. We all have read this aphorism, number 2. Yeah. The highest idea of Kuils, rapid, gentle, permanent restoration of health. We have been knowing this aphorism very badly. If we have to, convince somebody or, tell what are the plus points about homeopathy, we generally talk about that homeopathy is gentle and it causes permanent restoration of health. we stress on these aspects of it. In fact, there are times where we have now come to, to saying that we treat naturally. Homeopathy is a very natural, method of treating diseases. And generally, we stress on that we generally take care of patients in a very gentle and a permanent manner. Now, my question is, did Hahnemann also have the same understanding when he wrote this aphorism too? Because when I read this aphorism too, I find that Hahnemann uses the word rapid, gentle, and permanent. And even in the next, where he talks about the superlative degree, he talks of shortest, most reliable, and most harmless. Now, Hahnemann gives precedence to rapid and shortest over gentle, permanent, over reliable, harmless. The question is, this order of cure, is it random or it's a thought out plan on the part of Hahnemann? Now, if we had one aphorism, it would be difficult to decide. But when we look to Organon, we find the evidence of this question. Because in aphorism number 25, Hahnemann again uses the word rapid, radical, permanent. In 27, he again says sure, radical, rapid, permanent. I'm not going to the aphorism in detail. Let's just, understand how scientific Hahnemann was. So he talks about sure, radical, rapid, permanent. And you can rely on me, believe me, whatever I've written in red is there. So I have underlined it. So trust me for that particular thing. That what I am saying is just absolutely quoting Hahnemann's Organon. So aphorism number 47, he again writes of sure, rapid, permanent. So in all the aphorisms that we have seen, the rapidity holds precedence over permanency. In 51, again he talks of gentle, rapid, permanent. Here again we see rapid over permanent. In 53, we see sure, rapid, permanent. In aphorism number 70, we see quickly, permanently. In footnote 219, Hahnemann writes very clearly, perfectly, quickly, permanently. Now, we can have a question that what Hahnemann writes in aphorism number 2 is about the ideal of cure, that cure is like this. But he doesn't refer to probably homeopathic, medicines giving such rapid or quick results. That's why I wanted to, point out this aphorism. Because here he clearly mentions, Hahnemann clearly mentions that as pointed out above, neither man nor great nature can cure perfectly, quickly and permanently in any manner except homeopathy. So he is very sure that homeopathic cures are rapid and then gentle and permanent. In aphorism number 120, again he writes quickly and permanently. And here also he says the chosen remedy that will only give quick and permanent restoration. So Hahnemann has no doubt about saying so that, homeopathic remedies cause quick, rapid, and in the shortest possible time gives results. So here also in aphorism 143, he talks of sure, radical, rapid, permanent. Further, he also writes of rapid, certain, permanent. So the question that comes to my mind and probably should come to anyone's mind, why would Hahnemann give precedence to rapidity over gentle, permanent? Now that's where Hahnemann's wisdom comes into play. So Hahnemann's wisdom knew that humans by nature are impatient. And currently we are having the most impatient human species on planet Earth. If you can probably see, everyone wants instant tea, instant coffee, instant success, instant money. Even the Wi-Fi speed has gone from 2G to 5G. So why the cure should not be fast? Why should the cure not be? Because patients would only demand a certain fast relief too, and patient needs to have that particular thing. At the least amount of time, money, suffering on the part of the patient. That is what Hahnemann's intention was. So he stressed on rapidity again and again. Hahnemann wisdom also knew one thing, which we fail to understand somewhere, is this, that a system would be popular only if it is able to give rapid results over gentle and permanent also. Hahnemann somewhere understood that the hierarchy of rapidity is very important even at that particular point of time. Because the way we see allopathy, we all know that, there are a lot of side effects. So it's harmful. It's not gentle. We see that, allopathic medicines have to be continued for a very longer period of time. Sometimes they need to take 8, 10, tablets together or capsules together, but they don't give so permanent relief to the patient. We also know that, it suppresses. In spite of that, why would a patient or most of the patients choose allopathy over any other system which is gentle and permanent? That is because Hahnemann understood and realized that rapidity is a win-win situation, not only for the patient, but for the physician as well as for the system. And rapidity is that success formula which Hahnemann wanted us also to probably pursue. And we have somewhere not able to pursue. And that is why the results which we see about patients not coming to homeopathy, I feel one of the main reasons is rapidity, and which Hahnemann at that point of time was definitely aware about it. Because in Hahnemann, in Materia Medica Pura preamble, very clearly writes that many persons have repeatedly begged me to publish. We still want to know what to do. See, Hahnemann has answered here. Hahnemann says that there are more directions that people want me to give on this doctrine and of how to apply it in practice. And he says, I am astonished that after the very particular directions contained in the Organon of Medicine, more special instructions can be wished for. So for Hahnemann, whatever it takes to do a good homeopathic practice is all available in Organon. Problem is that we have not been able to understand or decipher Hahnemann clearly, and that has resulted into a lot of confusion and conflict. And that is why not only the entrant, but the one who has been practicing for a very long time also, many years also has a doubt in his mind that whether things are going right or wrong. So there are symptoms I talk about that, if whether you know Organon or not, the symptom is if you have a strong homeopathic foundation, you have the right sense of direction and purpose. You are an empowered physician, because Organon empowers the physician for what? Problem solving, decision making, and becoming a true physician, in the sense which Hahnemann has listed a lot of criteria for how to be a true physician. And it helps you achieve rapid and certain cures. Now, certain is one other aspect of it which I have not talked about it, but I can talk about it a little later, maybe some other time, because surety is one aspect which Hahnemann stresses time and again. So more than rapidity also, it's the surety that is where Hahnemann is talking about, that it is possible in homeopathic remedies. So there are, my dictum is no Organon, no homeopathy. If you know it very well, you have known homeopathy well. So what are the symptoms of not knowing Organon? Becoming overconfident. This is known as the Dunning-Kruger's effect, where, we also talk that half knowledge is very dangerous. Why? It's because, we go overboard. Every time I see a lot of students taking homeopathic cases and they say, oh, we can do everything. We don't understand where we have to set up a limit or a boundary. We become vulnerable to misinformation and scams. And there is going to be a disillusionment, disappointment, or doubt. So no Organon, no Organon, no homeopathy. And, I have been always talking about that for a particular time, because there are questions that people ask me, can Organon be replaced? I think this picture speaks words for it, that, it's one of the wonders in medical field. It cannot be replicated. And to sum up, I feel we have got lost because we have not been able to decipher Hahnemann clearly. And that is why we have a lot of ways and methods to probably go about. The only thing is, what I request is that if we have to leave a legacy for the future generation, which empowers them and gives them a pride to do that practice, then the need is we need to collaborate. Because what I have talked to you, believe me, in Organon is just a tip of an iceberg. Hahnemann's wisdom, I can vouch for it, is timeless. I see a lot of reflections in modern medicine books, whether you talk of physiology, anatomy, pathology, medicine books, I find a lot of reflections. And I know that even in futuristic medicine books, Hahnemann's concept will be reflected. I'm very clear about that particular thing. So thank you for having me here again, back again, and giving me a time to share what I have to share. If there are any questions that you have, you can please put it across. Until then, happy discovering.
Okay, Dr. Modi, you are co-host, so you can manage the question. If there are any questions from audience, please feel free.
If there are any questions, definitely I would.
People are writing in the chat, so.
So I need to open up my chat box. Yeah, for long-term chronic diseases, seated conditions, can those have rapid curing? Rapidity has not to do with chronic or acute. See, the way Hahnemann is talking about it, Hahnemann has never given this, distinction. He has given understanding of a chronic disease and an acute disease only to help a physician, for the prognosis. Otherwise, for the treatment part of it, I have lot of chronic cases which have, given, at least at my end, I have been giving fantastic fast results, and people call me magic doctor. My patients generally call me magic doctor. I know of cases where, I can put up cases where probably patient is having SSP, that is subacute sclerosing panencephalitis, who was with allopathic treatment, not improving, started with homeopathic treatment, and in around 10 days time, we could see a change and a difference in his total demeanor. So it has nothing to do with acute or chronic. From my perspective, and I think from Hahnemann's perspective, the type of disease is not the issue. It's how we go about doing it. That is what is there. So even in chronic, we can give fast results. Yeah. Any more questions, please?
I can see.
Yeah.
Okay, Dr. Modi, I have never ever thought I would be interested in Organon, but now I'm sure I need a right tutor.
Thank you. Thank you. Yeah, exactly. See, we need to understand one thing, that this type of a literature, which at least I have been using it for a very long time, and I can vouch for it, that let's put one of the things which you are talking of. Hahnemann also stresses on one other aspect, which is talking about surety and certainty. Is this that, there is a uniformity in getting the results. Everyone should uniformly get the same results which I am getting, which somebody else is getting, in the equal proportion. So Hahnemann's system is very well methodically, if you follow the system methodically, you will reach to that.
I understand you promise this is not the end of our.
Not an end. Yes, certainly yes. If the need be, I'm willing to definitely come across and share what I have learned, what I have understood, and how it's going to make a difference. It is a journey which is, I feel, magical. Going into this journey is really magical.
If there are any more questions, we can leave it to after we finish all the presentation. And now, sure. Dr. V, please help me.
Yeah. Yeah.
Okay. I met Dr. V in Sevilla for the first time. I did like his presentation. And as it often happens during these congresses, we met at the table, chatting. And I've learned about his book, which I've got. And I started to read it, and I got really this magical book, I can tell you. So I asked Dr. V to tell us something about some remedy, which I only know is fungi remedy, but I don't know which one, and I don't know the case. So I'm very curious now. Dr. V.
Okay, am I audible now?
Am I audible?
Yes, yes.
Okay, let's, without wasting much of the time, let's begin with the presentation. So after we had a wonderful presentation about the research study, then cardiological case, Organon, now this is a time to learn or to have some understanding about Materia Medica. I'm a Materia Medica teacher and a professor, so basically, but I think I must agree with Dr. Modi that all our cases, if we have Organon as a parameter, we can have a lot of good things. Not only, it's not possible to treat each and every case or cure each and every case, but we know, if we know Organon, we know everything. I think, thank you so much, Dr. Modi, for this wonderful presentation. So let's begin our journey with mushrooms. So everybody knows about mushrooms. If you see today's world, people are crazy, especially the youngsters are very, very crazy about mushrooms, mushroom drinks, mushroom powders, mushroom creams, and psychedelic mushrooms. So many things are known about mushrooms. The mushrooms and fungi, I call them nature's dual powerhouse, because they are surrounded by us, from simple mold, penicillin, to edible mushrooms, to antibiotics. Many, many things are connected with mushrooms and fungi in our day-to-day life. Nowadays, when people have displayed a lot of resistance to antibiotics, I'm talking in general about the medicine, people are considering mushrooms to be an answer to antibacterial, antiviral, antifungal. I'm not talking about homeopathy here. I'm talking about some researches that are available on net. Developmental issues in children, long COVID. One of my friend has got 101 cases of cecal core. I hope he joins, because he's still practicing now, for long COVID during 2022. There are numerous disorders. People think that mushrooms could be an answer from simple cold to cancer. And many cultures have used them. So whenever I study Materia Medica, I not only study the homeopathic Materia Medica, but I also study the clinical subject, the allopathic use, the historical use that I have tried to present in my book. So for many cultures, mushrooms were used as ornaments, medicines, healing agents, food making agents, yeast, everybody knows, killing agents, antimicrobial agents. So we are going to have a correlation through cases, our historic knowledge of our patient, knowledge of our Materia Medica, and the knowledge of medicine through a few cases. And I'm not going to talk about all the remedies still we have, because we have limited time. So I'm going to concentrate only on one remedy. So these are a few remedies that are available in homeopathy with mushrooms, Agaricus bovis tacical, and other remedies. So I have used 4 to 5 remedies quite often, but I think I must have used each and every remedy at least once in practice. So what is my definition of using the medicine? Because I feel that in homeopathy, there are certain remedies which I call starry remedies, like Lycopodium nux-vomica. Everybody wants to prescribe something which is tested, tried, and which has got a personality. But if you are prescribing only on mind, that is exactly against what Hahnemann said. Most of the mushroom remedies, like Ustiligo, are used as organ remedies against specific pathogens. But historically, if we combine this knowledge, we will be able to use those remedies for much more challenging cases. Because a homeopathic remedy should be working on mind, body, and spirit at the same time, and it must be useful. So if I want to prescribe Lycopodium, Lycopodium should be prescribed. I should know how Lycopodium nose symptoms are, how rectal symptoms are, how skin symptoms are, how Lycopodium headaches are. So if we have understanding about mushroom remedies in such a way, and it is supported by cases treated successfully or unsuccessfully, because not treating or a failure is also a kind of knowledge that we gain, that this is not working. So mushroom remedies could be used in acute, chronic, should act on each and every organ, including mind, from mind to body, body to mind. Let's begin quickly with the case. So this was a case which was brought to me
somewhere in 2006 and 7, there was a boy who was 2.5. I do not have photograph, but other cases I have photographic evidence and testimonial to support. That time, the computer and everything was not so much available, and we used to see around 50, 60 patients in a day in the evening. So it was very difficult to record, but I still have the boy who is 21 now. The boy was 2.5 from a very poor family, malnourished, weak, anemic, and he was brought to me for colicky pain. He was son of a carpenter, and he had recurrent infection. That's what they said. But when I saw the boy had a leaky umbilicus. He was sitting on this play horse, and his mother called him suddenly. So while getting up, there was a plastic on the horse that got stuck into his umbilicus, and he had a severe injury. There was a lot of pain, and there was a leaky offensive yellowish discharge from the umbilicus. Of course, I was not the first doctor who saw the patient. They go to the local doctor, they go to a specialist. When the specialist wants to admit the patient, they used to come to homeopathy. Now the things are changing since last 5 years. People have homeopathy as their first choice, at least in my area of practice, my catchment area where I practice. Because India, 60% people use homeopathy. So he changed 3 doctors, took antibiotics and steroids. And now he was asked, okay, now you need to get admitted, or you need, the parents were told that the boy needed admission. So after he was brought to my clinic as a doctor, because I said that clinical examination and Organon both are integral part. If I am not working online, I examine each and every patient. So his weight was 12.5. He had little fever, his pulse, respiration was good. He had good milestones in the past, but only thing that was visible was offensive discharge from the umbilicus, which was very offensive, and there was a crust formed. Investigation, because he visited specialist. 12.5 was hemoglobin, neutrophils, high ESR, and he had bloody urine and pus in the urine. So I don't know what kind of infection he had, where the infection had traveled to the kidney, because it was, more of an acute presentation. He presented to me in a very colicky condition. So this is what I do for all my patients. Diagnosis according to the modern standard, and diagnosis according to the Hahnemann classification, diagnosing of susceptibility, diagnosis of miasm, mainly in chronic cases, obviously, and then the diagnosis of patient as a person. This is created by my teacher, Dr. Kishore Mehta, who is also teacher of Dr. Sanjay Modi, and I call it, or he calls it as 5-point program. If you know everything, then the journey becomes very easy. So we knew that we are dealing with some kind of septic condition, probably bacterial, and obviously bacterial, but which bacteria, we had no time and money to. So I just saw the patient. And once you see a patient who has seen many people, many doctors, the symptoms are suppressed. He had all the suppressed symptoms, suppression is that I is absent. The patient will not have classical mental symptoms. He will have more pathological symptoms. The disease becomes so-called one-sided. What was visible? What are you expecting from a child who is 2.5 with a tremendous amount of pain? Swollen abdomen, colicky pain, better by bending forward. That was the modality. Red urine, which was visible because he urinated and his mother showed, see, doctor, he is having red urine. Loud rumbling and gurgling on auscultation, or even without auscultation, without use of a stethoscope also. And after repertorizing, I found Bovista as an indicated remedy. And he also had a peculiar symptom. The pain was better by flatulence. And the flatulence was very, very loud, noisy flatulence. So this is a picture of Bovista, the fungi, and how it will emit the spores. So it is also called as wolf's fart. And because of the obvious reasons, very stringy discharges with distended abdomen. And this is the golden keynote of Bovista that everybody knows, that whenever you are touching the body, whenever you are, there is a kind of pitting edema on the affected part. So I could see his hands and legs swollen. No, I know we are talking about maybe possibility of a glomerulonephritis. Maybe he will have rheumatic fever or something. I knew everything. But whatever the possibility, I had to help him. He was very poor. He was not in a state to afford the hospital. And I was sure that I'll be able to help him because we have helped many in acutes. So Bovista 30C was prescribed for 3 times a day for 5 days. The child was never admitted. The child is a 21-year-old man now. He's staying in Dubai now. He sends some of his friends and his family members here. So this was one of the cases that I saw that Bovista has worked. But is only the repertorization sheet confirming Bovista? No. Then I go back and study the remedy in detail. Why this has worked? Because of it followed Organon, the totality of symptom. But what is such a special thing in Bovista? This is my favorite materia medica, lipase materia medica. If people are aware of this, it exactly has got itching eruptions. So whenever you are prescribing, getting a result, your materia medica should have a confirmation in proving or in clinical materia medica. Adolf Lippe was my favorite. I usually use nowadays Clark and Lippe for confirming the symptom. And historical evidence. Bovista was a known fungi by ancient American people, and they used to call it baby's navel. It was not only me who has used it. People have used it for thousands of years, Bovista as a remedy when the umbilical cord is cut. And if there is a sepsis, people have used it. So I never knew about this. But after I get a result with very small remedy, I want to understand in depth what that remedy has to offer. So with this, we have used Bovista for many cases. Not necessary that all sepsis I'm using Bovista. No, that's not the case. But whenever there are symptoms indicated, my wife is here, she's attending. She will remember a case. That was a case of Cox abdomen with multiple operations and oozing umbilicus that completely stopped. And the mesh was also out. It was a very pathetic case for the patient. The case was also helped with Bovista, and at least the discharge was stopped. So historically, we have the evidence. So homeopathy is nothing new. The historical evidence that our ancestors, our forefathers had, people are using it. People are thinking about Bovista. If you open net and have a look at some research papers, anti-cancer, antimicrobial, antioxidant as an autoimmune disorder remedy for cosmetic allergies. So homeopathically also we use Bovista for allergy to makeup or for diarrhea before menses. These are only a few indications, but this remedy has got much of a depth. This remedy was called as Kakatus. They were considered fallen stars by ancient American civilization. The highest regarded medicine in by American Indian was Bovista. They used to wear garlands and necklaces of Bovista so that it protected them from ghosts and also from lung infection. So whatever wisdom our ancestors had, everything had a it was a two-way understanding. One was traditional, historical, and one was also medical. So Bovista was a known remedy. I'm going to talk about 2 more cases. So therapeutic use by ancient people, why and how Bovista was used. It was the highest regarded medicine, one of the highest regarded medicines by American Indians. And some people in Tibet and India also were aware about use of Bovista. Ear infections, perforations, erosions of skin, burns. Bovista was used as a dusting powder. Infusions for healing ships and with their ship's legs, sorry, the comma is wrong, and bones, universally as a hemostatic agent. Is it over? Do we still have time?
Yes,
is
yes,
it okay,
please.
Yeah, okay. So somebody's talking in between, so I think I am going to mute the person for better functioning. If there is somebody who is not muted, no, that's okay, sorry. So Bovista could be also used as a remedy for some other things. Okay. I don't know. Yes. So this is another case that I would like to present. This case was considered as a case of so-called cancer of the nasal cavity. I don't know whether it was cancer or fungal growth or something, some nasal polypi, but this was a Bangladeshi migrant because we had a lot of construction work in our area. So this Bangladeshi guy came to me with, because Bangladesh, like India, is very firm believer of homeopathy. So he had a kind of lesion in his left nostril. I never knew Bengali so well at that time. I can now understand it a little bit. The language was not known. He had a lesion in his nose. He was working as a mason for many years, and he developed some kind of tumor in his nose. Can you see the tumor? The pictures were very old, 2006-07. The camera was also not good at that time. So Mr. Rahim, his name, because he has allowed me to share his case. He had a growth in his nostril. Somebody said it's a fungal infection. Somebody said it's a nasal polypi, boil, or even a cancer. He saw many doctors, including homeopathic doctors. He tried with himself so many homeopathic remedies like sanguinaria, because in India and in Asia, Pakistan, Bangladesh, people know homeopathy so well as if it's their own medicinal system. So people read books which are available. And so he had tried Sanguinaria canadensis, Teucrium, Vinca minora. So he had tried whatever medicine he could think of. Then he had seen some homeopaths. He had seen a surgeon, or everything. He was given antibiotics, steroids. Hello. I think Julian, we need to mute you. Okay, sorry. I'm going to mute. Yeah. So he had seen many doctors, and the same thing usually happens before going to a hospital. They want to take your advice. So the mass was controlled in size with whatever he did, but it was not treated. So he couldn't understand a word of Indian language, neither Hindi, Urdu, or English that we speak. So the nose bleeding, he was with a translator. The bleeding in bed, so he only had certain kind of symptom. Every time he was blowing the nose, there was a bleeding. The bleeding was profuse bleeding, which made me think about the word C. The bleeding was in bed. As soon as he wakes up in the morning, there was a bleeding and stringy tenacious discharge. So Bovista usually has a stringy tenacious discharge, like Ustilago Kali Brome. So, sorry, Kali Bichrome. We will see that in a few slides later. So, and the most important symptom that I saw, he had giddiness after he was waking up in the morning. When he was blowing the nose, he was feeling very giddy. I know all these symptoms are peanuts. They are not homeopathic symptoms. They are definitely symptoms that, are very, very common to many patients, many drugs. But it was again a one-sided case. So after looking at the totality, I wanted to confirm it with Materia Medica. So after confirming Materia Medica from John Henry Clark, it exactly had the same symptoms. Bleeding of the nose in the morning, nosebleed during morning, sleep with vertigo. He had giddiness, vertigo. These are symptoms of Provus. So after giving Bovista 200, and you can see the result after 8 days. And one thing I have forgotten to mention, this fellow had an aggravation because not necessarily everybody has homeopathic aggravation, but this fellow had an aggravation. Maybe Bovista 200 was not a correct choice at that time, but maybe because after he had an aggravation, I had stopped the medicine immediately. Not all the patients with one-sided have an aggravation. They usually need a change of remedy after a few days. But this fellow an aggravation, so he was kept only on Saclac or placebo. After 8 days, after 2 weeks, there was no mass. I never bothered to find out, he never bothered to find out what the mass was, because that requires a lot of money, which we were not in possession of. So this was the result. I have used Bovista for many cases of nasal polyp, vaginal polyp also. So actual diagnosis needed biopsy. There were no means at that time. And the case was suppressed, becoming one-sided. Bleeding and stringiness were the most important symptoms. And now this is a comparison between 3 remedies, which Ustilago also has got discharges, stringy discharges, but I'm comparing 3 remedies that I had thought which were in the repertorization. Bovista, Kali bichromicum, and crocus. Bovista has got vertigo or giddiness with stringy discharges and bleeding. Kali bichromicum has got blindness. Crocus has got giddiness and cold forehead. These are the symptoms in the proving. These are the symptoms in Materia Medica. The patient of Bovista is very, very awkward. We are coming to the mental part. The patient of Kali bichrome is very tough, rigid, and strong. And crocus is 100%, I think somebody who has joined was mute. I must mute. Yes. Okay. So, thank you. Okay.
No,
so
for muting, please continue.
Continue. We have a last case that I presented at Sevilla, one of the cases. Okay. So, Keynes' directive, what Keynes says, a remedy is not fully proved until it was permitted and made sick all regions of the body. Not only prescribing Lycopodium on mind is okay. We must see Lycopodium tongue, Lycopodium nose, Lycopodium skin. Bovista was also inspired by Dr. Hartlaub, who was a German doctor who got inspired. Okay, Dr. Hahnemann is proving Lycopodium. I'm going to prove Bovista. This is how Bovista came into existence. Then this is the last case which I am presenting. So can Bovista work on mental symptoms or as a personality remedy? This is the last case. When I was entering into my cabin 8 years back, I saw a boy who was a dwarfish child. The family was known to me. She got her son and she had got a second-hand iPhone from somebody. And he just dropped the iPhone. The mother was furious, you know. Indian people, Indian mother, they are very furious sometimes and they do not see if wherever they are. So she was angry. She started abusing him. You know, you are a curse and you're not a good person. And obviously her constitution was also lachesis. It happened to be. So I called the boy into my room and she said, Dr. V, I'm tired of him. He's an idiot. He is neither Downs nor he's mad. He has no interest in anything. He remembers nothing. In India, you need not appear for an examination till you are in 8th grade. You are exempted. But she said it's impossible for him to make any progress only because of teachers' favors. He has got buttery finger. These were her words in Urdu. And unable to hold things, always dropping things from hand. This was the appearance of the child. This is the actual photograph of a child. Awkward, fumbling with things. They are very fidgety, fumbling with things, unable to hold things in hand, like Natrium and Apis. There was shorter, thick lips, poor mental process. After examination, I thought, because there was a history of thyroid in almost 10 people in their family were thyroid, and this child, I saw him for the first time. And I asked his age, and they told me his age. I said, no, the child looks very, very young. He looks like a 6 or 7 years. So I investigated him for thyroid test, and we discovered that he had juvenile hypothyroid and case taking highlights. So we examine each and every patient, and the thyroid faciae, the thyroid bruit, everything was examined. The clinical findings were pulse, the weight, and everything was examined properly. There was no thyroid nodule on examination. So after during the clinical examination, these are the things that I do as I've discussed. Patient as a person. Now what the person was. The patient came from a middle-class Muslim background. They usually have a consanguineous marriage, marrying with first-degree relative. His father was a very nice person, quiet, Muslim cleric. He was quite reserved. Mother was treated for thyroid with lachesis, and his older sister was treated with mandragora. This boy, I saw him because whenever everybody is getting better, then they think, okay, there's another boy, let's show him to the doctor, because I think if he has helped everybody, he'll help us, help our son also, but which may or may not be true all the time. Developmental milestones. He always had poor milestones, delayed speech, teething delayed, walking delayed, and he was considered as a dwarf. by local doctor. They showed him to a local doctor in UP and they said, okay, he's like a dwarf, because you are marrying in the same family. So he probably is going to be a shorter version. He's not going to be very tall. So they accepted. Then they started, observing that his mental faculties were weak. He was able to only see a few things, not able to write, mistakes in mathematics, mistakes in looking at the board at that time. Examination was the biggest disaster. Important symptoms, homeopathically chilly, desire for cold, shy, timid, awkward, buttery fingers, smiling. He was cheerful at home. Can you see? The child was still smiling when he was photographed. He was a very smiling child. So you have to compare Baraita and other children. Bovista is very, very close to Baraita and other children. And when we are talking about ADD, ADHD, this remedy is often neglected, which should not be neglected. So poor memory, difficult concentration, jerky movements of hands and feet like ticks, chaotic and slow. After repetization, phosphorus was the highest remedy, then pulsatilla, then we had Bovista. But the remedy prescribed was Bovista. And moderate susceptibility, 200 once a day for 5 days. Advanced pathology, because, we should have diagnosed him when he was 6. But I diagnosed him when he was 16 or 14 at that time. So it was a delayed diagnosis. So I don't know what I could have done for him. So there was a lot of damage. His cognition, his memory, everything was impacted because of thyroid. Advanced pathology, poor coordination and concentration, diagnosed, but still he was showing symptoms of as if he was, a Bovista personality. Patient as a person, his classical picture was available of mental symptoms, not only Bovista. So when mental symptoms are available, we know that the child requires a moderate potency or a person requires a moderate potency. So, and it was confirmed by many books on Materia Medica, Fatak, Clark, Allen, Allen's Encyclopedia. You will see an exact picture of a child with autism or ADD, ADHD, that kind of spectrum covered by Bovista. I was surprised to see Bovista indicated here because this was probably my first case where I had prescribed Bovista to a child of delayed mental development. My understanding of Bovista, to sum up, because I'm going to show how the boy is now. They were called fallen stars from heaven. They are very, very holy. But these people are also, they are like fallen stars from heaven. Means that in family, everybody is okay. And they are not, they are like, they are looked down by other people. Puffy look. These are these pictures. Because I cannot show you exact picture of my patients who are autistic or who have got, who are slow learners or dyslexic. This is an AI representation. If you see these two boys, they exactly look like some of my patients seated. With gastric disorders, malabsorption, diarrhea, noisy flatus, poor memory, infantile eczema. Infantile eczema is atopic dermatitis. So this is my general understanding. This has to be confirmed by everybody here, and if they can see Bovista study and confirm to their cases. Follow-up of more than 8 years. The remedy was prescribed into 201 m and Nm by 1 potency. Antimiasmatic medorinum was prescribed. Steady growth. And now the boy is 5'6". He has developed his secondary sexual characters. Now I saw him 2 days back when he was accompanying some of his sisters. He's around 5'7", 5'8". He has grown mustache, but mentally he is not the way he should be. But apart from mental thing, he has developed secondary sexual characters. He told his mom last year, I want to get married. He has developed a lot of physical things mentally also. He is trying to work with a clinical psychologist and our government bodies so that he could have something on his own, so that he could have a job or something. So this was a case. So what is a take-home message here? A remedy, any new remedy. See, fungi, everybody is looking at fungi. If you ask people all over the world after cannabis, CBD, They want to know about fungi. Oh, I want to know about fungi. I want to know about fungi. People go like crazy in Alps and in Himalayas to search for fungi and mushrooms. I know so many people, some of my friends have gone and found nothing. Everybody thinks fungi is the next thing. I 100% agree that according to the modern medicine also, there are so many drug resistance things happening. So if you show them logically that homeopathic medicines made up of fungi could be an instrumental medicine in cases where you have drug resistance bacteria, drug resistance UTIs, ADD, ADHD, or slow learners, dyslexia. When you combine them with a clinical psychologist, fungal remedies like Bovista, agaricus, and another remedy that I have prescribed for many people, and Sequel cord, these remedies are very, very wonderful remedies. Because now people are making experiment with kalis. I tell people, you make a medicine with orangutan, red elephant, white elephant, 5 kali milk. There are so many remedies. These are available now. Find missing link. It's not possible for us to know everything about a single remedy in this lifetime. The prover's data has to be verified with the clinical data, also with the historical data. And whenever you have some new discovery, it should not be a one case wonder, because I got one case of mandragora treated, I am making a philosophy on mandragora. No, that's not a good thing. A mandragora should be used as a remedy for personality, for epilepsy, for headache, for skin. I should probably know at least 8 to 10 clinical uses of mandragora or bovista or orangutan as a remedy, red elephant as a remedy, so that I'll be able to share with modern people, modern medicine people, and my patients who are internet savvy, techno savvy. They probably know more things than me. I do. So all the symptoms must be historically verified, clinically verified, and repertorization and use of Organon. And if we have those tools, I think we can use a lot of fungal remedies. And historically, homeopathically, our masters have mentioned that the fungal remedies could be useful for maybe some possible permutations and combinations of viruses and diseases that we are going to see in next 200 years or next 1000 years. Thank you so much.
Dr. Modi, could you please comment on fungi?
See, I believe that medicines, the way Hahnemann has probably talked about. So agaricus has been a very old remedy, which I have used in a number of cases, especially where there are muscular, issues with that particular type of a thing. One of the important point where I have used is agaricus is when, somebody had an eye problem, and he at that time felt that he had an increase in his mental strength. So I took up this particular symptom, and with his eye problem, he had a good vision recovered. He had lost a vision. So agaricus is a very good remedy which comes up into a lot of usage, at least at my end. Bovista is another remedy which I have been using often in practice. So what we is talking, which I would probably maybe see, the remedy has to have a detailed understanding. With the detailed understanding, it becomes easy to prescribe the medicine. What happens is the clarity of prescription on the part of the physician is also important. When you give a remedy, you have to be very clear of what are the basis of prescribing. Like in, the case which Dr. Jeggels mentioned, he had a very good clarity of what he is doing and why he is doing. That type of a clarity will help not only practitioners, but even it will help patients to get more faith, more trust in homeopathy, which we find is, going down nowadays. Because there is a lot of what I say, I see probably when I say, or I see that there is a lot of, speculations that are being made in when giving a remedy. It has to have strong footing And the groundwork of the remedy has to be very strongly, a good foundation has to be made around. Thank you so much.
Thank you. Professor Frass, do you have any comments? Can you please unmute?
Yeah, I'm trying.
I think I like Bovista very much, especially if there are severe side effects from antibiotics. So I think this is what I've used it so far, but I have learned a lot from you.
Dr. Jeggels, are you here? Are you there?
Yes,
Yes,
the fungi, and so for the remedies that Dr. V was discussing, those are remedies that I use quite extensively, like Cicale cornutum, Bovista, Agaricus, etc. They're all being used. Cicale, of course, I have used extensively for diabetic gangrenous wounds or even non-diabetic gangrenous wounds. Many patients. Agaricus often used in, as Dr. Modi said, for rheumatological problems, especially back pain and so forth. Patients come with back pain, it is more centered in the spine. Then agaricus also in eczema. Very severe itching in eczema. The interesting thing of agaricus in eczema is that when a patient exercises, is hot and sweaty, there is no itching. And as a patient cools down, then the itching starts to come on. So there you have the differential diagnosis between agaricus and oxalic acid. Is it now not occupied, or is it because I'm not exercising? Physically exercising, yes. Bovista, also eczema. And it's interesting, Bovista is, as Dr. V would say, the full moon affects these patients quite a lot. They tend to itch with full moon, with eczema, etc. I've not experienced patients like the psychological problems and the developmental delay. I've not had patients like where I came across Bovista yet, but certainly thank you for that. Okay, thank you very much. That is my comments on it. Thank you.
Okay, so once again, thank you all, and hope to see you soon. It was a pleasure.
You're welcome.
Thank you so much.
You're welcome.
Thank you so much. Thank you so much. Bye, bye. Bye, everybody. Bye.
Bye.
Bye.